the study really was about collecting data. We conducted primary research in Buera District Watch 22. Here's a case study really to understand in depth the issues within a particular well-defined locality. And at the same time also collect data that is published, peer-reviewed journal articles, secondary data, analysis of also secondary data, to be able to inform our understanding of the challenges within the apostolic community, focusing primarily on maternal newborn child health outcomes. So we followed this particular process. I'm not going to go into really spend time on it. Suffice to say that the information is actually available in the document that will be later released by UNICEF. But similarly to Karen's work, it was a qualitative study. And with the limitations of case studies that she has spoken to, we also experienced the same. But that's not to say there's no relevance in a case study, because we're trying to understand issues in depth. So we conducted in-depth analysis. We spoke with apostolic birth attendants, we spoke with religious leaders, traditional leaders, health officials at district level and at national level, as well as engaged not only the adolescents, because we also realized that they're an important constituency, but also women who have gotten service from the ATBAs, from the faith healers, as well as those that have experienced loss at apostolic health system. Because this is very important. When you understand people's experience, it also reflects their experiences, not only their experience, but how they relate with this system. What are the benefits, what are the disadvantages, what are the costs of uptaking apostolic health services. But to understand health-seeking behavior, you have to situate it within context. Therefore, it's imperative that you understand behavior of an individual which is nested within other contexts. It could be the family, it could be the community, it could be the institutional, it could be the social culture. And this is very important because when people make a decision to use a specific health system, it is informed by a number of factors. And that's very important to understand that. Because when we focus on the individual, outside the context, you miss the influence of the context and the various systems on the individual. So it's very important to understand that interaction between the individuals and the various social systems within which they live. So the question really is, we've had about religious objection to modern healthcare services. What are the drivers? This will unpack. Karen has spoken to some of the reasons for some of the objections, but it is also important to situate this just to see how religious objection plays a part. This was an analysis that was done in 2011 by her and others, looking at the ZDHS 2010-2011. Based on the statistical analysis, we actually realized that apostolic religion, which is the blue, in most cases performs poorly than other religions, with the exception of traditionalists, right? But we also understand that apostolic religion is also linked to tradition. That's very important. So there's a double burden of religious faith, which is Christianity, and traditional beliefs. So that combined influences the health-seeking behavior of the apostolic. And this actually now causes us to say, as much as they perform better than the traditionalists, but when you look at the sheer size of the apostolic community, Karen has alluded to that, we're looking at 38% of women in reproductive age are apostolic. So given that sheer size, and you're looking at maternal newborn child health outcomes, isn't it important that we also focus on that particular group in order for us to improve this maternal and child health outcomes? So I've just given you just a quick understanding of the issue, but if you don't situate it within the founding doctrine, understanding apostolic doctrine is very important because it is a key variable in influencing health-seeking behavior. I'll speak just to one, just to give you an understanding of Joani Marange. If you read the documentation, how he articulated his divine calling in Umbo Ucha Wava Apostol, in that particular document, he describes how he was called, the emphasis on use of holy water, not only use of holy water, but also faith and divine healing, but also to the objection of use of medicines. In the document, he speaks to traditional medicines. When he got his vision in this revelation, to tell the African people not to use traditional medicine, but it was broadened to include any medicine. Hence, that has come to affect the Joanne Marange group's attitude towards use of modern medicines and health services. But when we look as well to Paul Mwacha, when he started, he had also a divine calling, which is recorded in his Divine Commission document, which speaks similarly to the issues of faith healing. Karen spoke to the cross-cutting issues across all the apostolic groups. You find that most of them are true across the groups. However, what you find with some of these spirit-type churches, for example, ZCC, it's an appreciation of modern medicine, of education, and they tend to have a developmental thrust, unlike the other religious groups, which is very important. People normally say the apostolic groups are the white garments. Not necessarily. You can also, the diversity of the colors. I think as you travel, you also see the different groups. So what is the basis of religious objection? It is linked to the doctrine, to the founding beliefs of the founding fathers of the apostolic movement, and that's what makes it difficult to even promote some of the changes, because the doctrine, especially when it's embedded in the divine commissions, it becomes the Bible, becomes sacred. But also there's an issue of education. If you don't understand the anti-Western stance in the history of the apostolic movement as a resistance movement to the domination of the colonial regime, you will miss how they resist some of the things that are called Western, including modern medicine and the healthcare system. Gender issues are very important to understand, because it is one of the dynamics that affect women's ability to utilize services. And the scholarship around it, a very interesting read there by Mukonyora, Wondering in Gendered Wilderness, Suffering and Healing in the African Initiated Churches. Basically, she speaks to how religion, the apostolic religion, impose gendered limitations on behavior. A quick framework, just to highlight the pathways for care seeking. You have a pregnant woman there or postpartum seeking care, and she's got challenges. Where does she go? She prays, she goes to an ATBA, delivers at home, and it ends there. Or she can go to an ATBA religious leader, get the faith healing rituals to take place, and she delivers at a birth camp. Or she may opt, even within limitations of the religion. For example, we know in Joanne Marange, women are discouraged from using modern health services, but we also know that women have taken on, deployed strategies outside the church to seek care as much as they are restricted from seeking that care. So it's very important to follow and examine the pathways. In our collecting the data, we visited this young girl, 15, that was last year, end of last year, pregnant, 7 months pregnant. And really for us the question was, what is the prevalence of adolescent pregnancies within the apostolic community? So we went to Murambila to just try and understand what's the prevalence in the community, and using the district to really understand the challenges of adolescent pregnancies. Look at the data there. You have close to, that's about 95% of your young girls aged 16 to 19 pregnant and delivering at a health institution. So already that data, as limited as it is, it paints a picture to the challenges related to child pregnancies. And what are the drivers of child pregnancies? I think that's a sociological question that we need to understand. The role of dreams. divine or spiritual dreams. A man says, oh, I dreamt marrying so and so, a specific girl. And because it is a prophetic divine dream, the young girl is handed over to an older man to marry. But for those that fail virginity testing, what options do they have but to marry a young girl, an older man? Because of the shaming, the humiliation. But there's also impact of that humiliation. And I'll speak to that quickly later on. But we also realize that modern family planning is not encouraged. It's the traditional method of withdrawal, which comes at a cost for some of the women. But also the conviction that a woman has to get pregnant as many times as is divinely possible. It is a divine mission for a woman to give birth to as many children as is deemed divinely possible. Therefore, there is no role for family planning. So this is one interesting quote that we got. Really speaks to how fear is instilled, but also couched within religious language, apostolic language. Because women are scared to die. If they do take modern medicines, they have to confess. Otherwise, they face the wrath of God. I'll skip this because Karen has covered the role of ATBAs. However, one of the things that came out is the issue of the value of a child. What's the value of a child? A child is like a brick. If a child dies, you know what? For a woman, get pregnant as soon as possible and give birth to as many children as possible. Therefore, they are likened a child to a broken brick. If it dies, then a woman has to give birth. Fall pregnant again. Divine call. Have babies. Karen has covered this, but there are issues really around the diagnosis. What they call the spiritual diagnosis. The role of the Holy Spirit. That in itself poses limitations in terms of the need to take modern services. This Karen is covered. I'll skip. However, what we noted are the glaring weaknesses within the apostolic health system, particularly the management of pregnancy complications and also postpartum complications. When a complication is related to evil spirits, therefore, the focus should be go to a prophet, go to a faith healer, because they are the ones with the power to deal with evil spirits. The interventions, the Amen intervention, which is the Apostolic Maternal Empowerment and Newborn Intervention, it's a broad intervention really that seeks to reduce apostolic maternal and neonatal mortality and morbidity, but it requires a diverse range of interventions that intersect to address the complex challenges that the apostolic communities face. The first one speaks to engagement. Karen's work also addresses that. It is very important to engage apostolic religious leaders. We've seen modifications in doctrine. We've seen an acceptance of changes which really can affect the way women uptake services and also the way men support women's ability to uptake those services. If I take you back to the findings of adolescent pregnancies, it speaks to a huge gap in adolescent sexual and reproductive health. Not only that, the sociological issues around early marriages, child marriages, have to be addressed and make sure that at least we empower the young apostolic children to dream big. For women, really it's around strengthening self-efficacy and agency, because they can deploy strategies, and they've managed some of them, even within the ultra-conservative groups, to actually seek care. After seeking care, then they go and confess. Ultimately, we have to innovate in terms of our service. Rather than waiting for the apostolic women and babies to go to the clinic, you can take the clinic, the service, to the people. And we've had incidences where village health workers and nurses are using community gardens and platforms to deliver health services to the women. These are low-cost interventions, but they are worth exploring whilst other changes are taking place. Most importantly, we have to revisit the conflict between the right to religion and the right to healthcare and the right to education. Professor Felto will speak to this when he looks at the intersection between religion and the law. We cannot afford to allow women and children to die. Engagement with leaders is very important, but also we need to build and strengthen the political will to achieve that. Above all, apostolic communities are diverse. There are varying degrees of religious objections. There is room for change. Thank you very much.